Hi guys, this is Dr. J. This is my first video ever. I just wanted to say a few things about RSO. It is what I crassly refer to as the black tar heroin of THC. So it typically comes in a syringe. It's a thick, viscous liquid. It's just really concentrated THC, but it's full spectrum. So it has all the terpenes you're looking for, all the medical benefits, and can typically come in ratios of 1 to 2 or 1-to-1 with CBD as well. So it's just an example of a partially used syringe of RSO. It's very similar to FICO, which is full extract cannabis oil. RSO stands for Rick Simpson oil. So RSO is for folks who have a high tolerance and or are looking for real symptom relief, severe symptom relief, that would be. So typically one of these syringes entirely will have between 600 and 800 milligrams of THC. Keep in mind a gummy normally is 5 to 10 milligrams, and I have a lot of patients who will cut those in halves or even quarters and just use that much every single day. So this is really a heavy hitting product in a small amount of volume. So it's pretty good bang for your buck as well. But you've got to be really careful with dosing. So dosing is really, really tricky because typically they'll have little demarcations on the syringe, but it's very difficult to do 5 things at once. You have to carefully take this off, very slowly and carefully push this very tough syringe down onto whatever you're going to dose it on, whether it's a toothpick or one of those little flossing picks, or I like to put mine directly onto a fatty food like peanut butter, almond butter, pecan butter. But it's very, very sticky, very viscous, very thick. Once you get it on something, it's very difficult to get off, including your teeth and your fingers. You need to use alcohol or another solvent to get it off. So I advise dosing just with a squirt around the size of a grain of rice. That will get you between 30 and 60 milligrams. You can do your own math and sort of start low and guesstimate from there, but I wouldn't recommend for starters especially more than half a grain of rice in terms of how long the little sticky squiggle will be. Again, THC and CBD are fat soluble, and so it would be best to eat this with something containing fat, whether that's a spoonful of a plant-based saturated fat like I typically do, which would be coconut butter, coconut oil, I suppose, pecan butter, almond butter. It's my excuse to buy exotic bougie butters. I just finished a Brazil nut butter. I'm an eccentric foodie. So anyway, that's all on RSO. I hope this helps. If you have any questions, just let me know.